Welcome to Firehouse Animal Health Center's newest spot, conveniently located right off of 183 in North Austin. This new hospital features all those special touches pets, and their people too, have come to expect, like bright open reception areas, pet-friendly exam rooms, and cat-only spaces. But there's an extra special touch here. All of these beautiful pet-themed portraits were painted by Firehouse 183's medical director, Dr. Brianna Armstrong, who we're about to meet to learn more about this special new spot. Well, Dr. Armstrong, thank you for having us out to the new Firehouse Animal Health Centers off 183. You're in a new community, and a new neighborhood can enjoy your amazing services.
Thank you. Yes, we're very excited to be here. We opened not too long ago, and we're up and running, fully functional, full-service hospital.
I love it, and I noticed around the corner there's a neighborhood right there, and I think how lucky, how great it would be to live right there and have such great experts right around the corner. And I think a really great way, a great first subject to talk about here, which I think demonstrates so much of what Firehouse Animal Health Centers is all about, is Sweet Raylan, who's actually yours. But the story of how this all happened is so wonderful, and it encapsulates that Firehouse Animal Health Center spirit so well.
Thank you. Yes, we met Raylan through the Wilco In-Kind Donation Program. And so Firehouse is really great, and they sponsor many services for the shelters around the area.
Yeah.
And Wilco brought him in because they found him in the Williamson County on the streets. He was so skinny, and his left front leg was not in great shape. He couldn't really walk on it at all. And he was already almost three-legged when we met him.
Yeah.
Firehouse is great about working with specialists in the area, and we brought in an orthopedic surgeon to come and check on his leg with us to make sure that we were making the right decisions to moving forward with him. We determined that the best option for him would be to remove the leg because it was causing him so much pain, and over time he would just be living with the discomfort of that leg.
Right.
So I did his amputation, and he did great through the surgery, and I fell in love with him. He was so sweet, and I ended up adopting him thereafter because he was just such a special dog, and I loved him so much.
How could you not? I mean, I can't imagine more of a bonding experience in that healing journey anyways, but also, look at his face. This is a sweet, sweet dog. And like I said, I think that really just kind of captures what Firehouse Animal Health Centers is all about in working with these local nonprofits to the doctors having such a passion and love for these animals.
Absolutely.
That's very cool. Dr. Armstrong, introduce us to our furry feline friend here today.
Absolutely. This is the beautiful, handsome Stanley.
He is handsome.
He presented to us about 2 years ago is when I met him. I actually met him at the Firehouse Round Rock location when I was an associate over there. And we were just checking him up for wellness. She had no concerns or worries.
Interesting.
So we got his blood work done and gave him his vaccines and everything. And then we got the blood work back the next day, and we actually found out he was severely anemic.
Oh.
And what that means is the red blood cells in his body were really low, and the red blood cells are what bring oxygen to the tissues and organs. Without that, they can't function properly and they can die. And his levels were at a point where if we hadn't have done that wellness blood work, we could have missed that and he would have maybe passed away.
Oh, goodness.
So we started treatment about a year ago, and he followed us here to Firehouse 183. We are slowly getting him off of his meds.
Aw.
And he's doing really great. I think something that's really important to mention is that Allie, who's his owner, is a veterinary professional. And even she had a hard time noticing the symptoms, that he was just like more chill over that last year. No real symptoms of him being sick, and cats are notorious for being really hard to notice if they're having problems. So doing that annual checkup with blood work really helps us catch those things early, like we did with Stan.
Very important. We've learned that through conversations, how good cats are at hiding what's wrong with them. But those wellness checks are so important, even if you feel like nothing's wrong. And this is a perfect example of that.
Exactly.
Well, Stanley, we're great to hear that you're doing fine, and clearly you've got your appetite back. Excellent. Now, Dr. Armstrong, we've talked a little bit about how important wellness routine checks are in your average daily visit to the vet, but sometimes things run outside of those normal visits, and you're equipped here in the surgical suite to handle some of those things.
Absolutely. We had a patient recently that came in just a few weeks ago that we met for the first time. Her name was Holly. She was a 13-year-old little Maltese. And unfortunately, she had this really big mass on her face that was bleeding and causing her discomfort. It was a question of, you know, is it better to risk anesthesia and take this mass off because she's a little bit older?
Right, yeah.
The other thing with her is she had a pretty severe heart murmur. So she had a heart condition that made her a little bit riskier of a candidate for anesthesia.
Oh, I see.
But because the mass was causing her so much trouble, we decided it was worth the risk of a short anesthetic procedure to get this mass off for her quality of life. Because of her heart condition, we elected to use cardiac safe medications for her sedation protocol. We also started her on a heart medicine to help her heart function better a few days before the procedure to give her the best chances of making it through and doing really well afterwards.
Very cool.
So what we ended up doing was, instead of intubating her, we did a sedation and then also did a local block, which means we numbed the area around the mass for removal. We got the whole procedure done in 14 minutes.
Wow.
And doing shorter sedation protocols, especially for dogs with heart disease, is really good as far as limiting the risk and makes it more likely that they're going to do well post-op, because the longer your sedation and anesthesia time, the more risk.
Yeah.
She's doing fabulous. She is more energetic than ever, and her mom said it was totally worth it, and she's feeling really great these days.
I love to hear that, and it's another great example of how thoughtful you are about the animal's care, that you're really making sure that you're doing the most to get their quality of life and the best result out of that. I think that is so cool, and you're equipped to do it right here.
Absolutely.
An easy way to spot Firehouse 183? Camille, this giant elephant outside, has become their unofficial mascot. When Firehouse moved into this new location, this elephant landmark was already there, and they just knew they had to do something special with it. Their hospital manager lived in Kenya and knew of an elephant sanctuary, so the Firehouse team hosted a contest on social media to name him. Camille was the winning name, and now Firehouse 183 sponsors the real-life Camille at that elephant sanctuary. Dr. Armstrong, thank you for having us out to your newest location here at Firehouse 183. It's great.
Absolutely. Thank you so much. We're so happy to be here, so excited to serve this community. We're open, we're accepting appointments. Give us a call. We do work-ins, drop-offs, in-room appointments, whatever you guys need.
Very cool.